Hi, my name is Valerie, and I'm going to give you a speech on the proper use of oxygen with a nasal cannula, a mask for oxygen, or the nebulizer. First of all, this is Abby. This is my patient. The oxygen tank. The first thing we're going to talk about is a pediatric cannula. And that's what this is. No, it's not. Yeah, it is here. It has the little nasal things. It actually will go like that. There. Okay. When you do the nasal cannula on a child, sometimes the airway can be compromised if the child is sick and has a lot of nasal secretions, so then you would want to use the mask.
Because she's a big kid.
Here. Okay, that's the mask. Now the difference in the liters per minute with a cannula or a mask, the cannula is going to be 2 liters per minute for the infant or newborn. The toddler and child mask is going to be 4 liters per minute, and the adolescent and adult is going to be 6 liters per minute. It has to be higher with the mask than it does with the cannula because the child can rebreathe carbon dioxide. The mask, the liters per minute for the pediatric is 5 to 10 liters per minute, and the adult mask is 6 to 10 liters per minute. The third one we're going to talk about is if your child needs a breathing treatment. If coughing, wheezing, you're going to go, check out the patient to see which device you're going to have to use, and then you'll get the doctor to come in, evaluate the patient. They'll give you the orders, obviously. This patient is not only wheezing and coughing, but their oxygen saturation is low. So we're going to do oxygen along with a breathing treatment. This is the nebulizer where you will hook. I got it confused. This is the nebulizer where you will hook the tubing to the nebulizer along with the oxygen. No? You will hook that's right. You'll hook the tubing from the nebulizer mask to the oxygen, correct, with the medicine inside this container right here. Okay, so Abby is going to get albuterol and Atrovent along with oxygen, and because it is a mask, you have to increase the oxygen as well so that the child does not rebreathe the carbon dioxide.
How high does it have?
With the mask, especially with the solution, you have to turn the oxygen up high enough to get the mist to go. The proper amount for an infant or newborn, 5 to 6 liters. You cannot lower it lower than that, or the child will rebreathe carbon dioxide. But also, you have to remember that any mask, especially this one in particular, is not a transport medium for oxygen. It's only a transport medium for the nebulizer solution, albuterol or Atrovent. As soon as those medicines are done, you have to take the mask off and either put the cannula or the pediatric mask on that is only for oxygen. And that's it. Thank you very much.
Questions?